There's no question in my mind that fat grafting makes my facelifts better, and that ever since I incorporated this principle into my facelift practice, my results have taken a much better turn. And so I want to talk about why I am fairly insistent about fat grafting and some of the implications of fat grafting if you've had fillers before. If this is something that your surgeon has discussed with you or you're considering, stay tuned. Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon in Newport Beach, California, and I perform facelift surgery quite often. One of the most important aspects of my facelift surgery practice is fat grafting, and it's something that I would say maybe in 2016 or 2017 I took very seriously, because in the past it seemed sort of like a fluffy adjunct to facelift surgery that took a lot of time, caused a lot of bruising, and may or may not have actually had a long-term result. And I think that was a very immature philosophy. Unfortunately, that a lot of even veteran facelift surgeons still employ today. So why is fat grafting so important to me? And why am I so insistent on it, especially in patients who are like, my face is already fat, I don't want any more volume in it, please don't do fat grafting? I'm going to tell you. So the facial aging process isn't just about skin becoming loose and sagging. There's also a component of skin quality compromise as well as loss of volume in your midface, especially around the lips and around the eyes. That kind of presents itself as sort of sunken or deep set eyes that if you were to compare a picture of you when you were younger versus now, you'll see that difference. The volume around the eyes does go down. And so eyelid surgery has changed over the past 30 years in that we are a lot more conservative about the amount of volume that we resect when we do upper blepharoplasty for this very reason. But facelift surgery seems to be a little bit slower to catch up to that principle. There are a few mentors of mine who have encouraged me to really pick up the fat grafting aspect of my practice. And because of their support, I think that my results have taken a much better turn. So the facelift itself is only a piece of the pie. You think if you're going to go in and get a facelift with me, I'm going to be spending 99% of the time doing facelift and I might put in a little bit of fluffy fat at the end. That is completely untrue. I spend approximately 1/3 of the amount of time in my facelift fat grafting. Why do I do it? Because as we age, there is predictable volume loss in the cheeks, underneath the base of your nose, and even on the corners of your chin. In addition to the temples, I think temporal hollowing is a telltale sign of facial aging, and the glabellar complex. I mean, you name it. If you have a consultation with me, I will draw out precisely these areas. This isn't a way to upsell the facelift. This is part of my facelift. And so a lot of people have a similar question. I really want a facelift, but I don't want fat grafting. I think it's just a waste of an opportunity. I think the opportunity to fat graft is what makes my facelift stand apart and look more natural. The fat itself may even have regenerative capacity. It may even provide skin improvement. We talked about the different factors and features of aging. I mean, part of it skin compromise, part of it is descent of the skin envelope, and then of course part of it is volume loss. That fat grafting component allows me to not only better and more artistically sculpt your face, but also to potentially revolumize and hack the biology of facial aging, and also to potentially regenerate compromise in the quality of your skin because of, for example, prolonged sun exposure or smoking in the past or something like that. If you've had fillers, how does that play into our facial fat grafting? So it would turn out, I'm going to guess that 90% of the patients who are having a facelift with me have had fillers in the past, if not a prolonged history. And now we're becoming more aware of some of these nuances and risks of the overfilled face and sort of the potentially irreversible aspect of chronic filler in the face. We call it filler fatigue or pillow face. You've heard of it before, you've seen it before. When that presents, how does that play into fat grafting? If you've got a lot of volume there that's not going anywhere, what do you do about it? Unfortunately, we're going to try to dissolve it. I think once you dissolve as much as you can, you're going to see the amount of atrophy you actually have, and then we can correct it with a biologic alternative that doesn't need to be replaced or maintained every year or so. I think fat grafting is a much safer long-term correction for facial atrophy, but it's also a much more powerful and artistic tool. The fact that you've had fillers before, for example, sculpture and things like that, that can't be dissolved, well, unfortunately, that's a hurdle that we're going to have to work around. But if you've had a lot of fillers in your face and you think it may be contributing to your facial volume or your facial shape, it's definitely incumbent upon you to ask to have this dissolved in advance. Not only will that give me less obstacles to work around with a fat graft, but it will also allow us to better correct for perpetuity the volume-related changes that you've hidden in the past with filler. So these are my thoughts. Facial fat grafting, facelift are one and the same at Zelken Institute, and that's the reason why. It's a very artistic and strategic and wonderful adjunct that contributes to a natural appearance. It's not intended to make you look fatter. Even if we put in 50 cc's or 2 shot glasses of fat into your face, you'd think that's going to be a crazy amount, but distributed amongst your whole face and your temples, you'd be surprised how subtle over 4 to 6 months that becomes. So these are my thoughts. Thank you for watching. If you have any questions or comments about fat grafting and facelift, please do ask below. Be sure to turn your notifications on, subscribe, and thank you so much for taking the time to watch this video. Bye-bye.